Welcome back to movementprofessional.com. So this video is in response to a question I got regarding a client presentation of walking or standing with the right foot turned out compared to the left. So I just wanted to do a video to talk about some possibilities of why that might be or what might be happening a little deeper by looking at the mobile pelvis. And then also contemplating what you might see from a range of motion standpoint with some table testing. So coming down to the ground here and looking at the pelvis in supine, we really have three possibilities that we can see for why we would get this right turnout. So one would just be that the pelvis is just oriented to the right. So like this right side just tips to the right, and that just moves basically everything to the right. So in this case, you would see increased external rotation on this hip, probably increased abduction, and likely more of a straight leg raise on this side as well. And that's going to be just like everything is going that way. We could also get an anterior orientation of the pelvis, so everything just sort of tips forward. And then that is going to make the attachments of the internal rotators, gluteus medius, gluteus minimus, get closer together, especially when we tested inflection here. So now the trochanter basically gets closer to the attachment on the back of the ilium, and now it's going to be tighter going into external rotation. So we're going to be more limited into external rotation. And then, basically we can have a scenario where we're still rotated to the right. So we're still oriented to the right. We just can't turn into external rotation, but the foot may still turn out in standing just because everything is still oriented to the right. Or we're not so much oriented to the right, we're just basically oriented forward. And the tibia has to compensate for the lack of external rotation at the femur. So that starts to turn out, and that also can be responsible for the turnout that you see. So there's different things that you have to be able to look for there, but just know that you could see a loss of both internal and external rotation when you see someone standing with this kind of right turnout position. So hopefully that makes sense. If you have any questions, you can go to movementprofessional.com. I'll see you next time.